Yes. Right. Hello and welcome to Seven Sentinels. This is Grandmaster class, and this is a series of speaking sessions, super solid speaking sessions, never-ending, non-stop, new sense. Today we are going to take speaking sessions. Today's topic is insulin injections, speaking sessions, role play number 1. This is Grandmaster class, a part of classical corrections from Seven Sentinels. At practice with Peter, the English language doctor. Today we have with us Shravanti Damara from Hyderabad, Telangana, India. We are going to do the speaking role play number 1, insulin injections. This is the role play card for the interlocutor, role player card, the patient's card. And that is for me. And this is the card for the candidate nurse, Shravanti. And we are going to have a one-on-one speaking session live. So we are back to the card. This is the card. So Shravanti, you have 3 minutes to prepare, and you have already prepared. Again, your sufficient time. And then now we are moving to this session. Yes. Hello, Shravanti.
Hello, sir.
Yes, Shravanti Damara from Hyderabad. Okay, role play number 1, insulin injections. Speaking role play number 1, diabetes, insulin injections. Nurse, role play initiation. Yes, nurse, you can start now.
Before going into the role play, I would like to know your name, sir.
My name is Lincoln. You can call me Abraham Lincoln is my name, so you can call me Lincoln.
Okay. Good morning.
Good morning, nurse.
My name is Shravanti. I'm one of the nurses working in the community center. Is this Mr. Lincoln's house?
Yeah, you're absolutely right, nurse. This is Lincoln's house, and I'm Abraham Lincoln. Come on in. Please have your seat.
Thank you, Mr. Lincoln. So I understand that you have diabetes and you have it well controlled by diet and oral medications till recently. But as your doctor requested me to show you about, demonstrate you about insulin injections, because your diabetes have been not under control with the diet and medication. Am I correct?
Nurse, actually, that's whatever you have told is absolutely fine. But the thing is, I have been managing my diet well, excellently. And with my diabetes diet, medication regimen, and exercises prescribed. Everything is going on well. Then what is wrong with this doctor? Why is he suggesting me to change my treatment plan?
Mr. Lincoln, I am sorry to hear that, but I would like to explain you about your condition. The doctor have advised for self-insulin administration because your diabetes is not under control with the medications and diet which you are taking. So it is very important that you need to take insulin injections. Are you understanding, Mr. Lincoln?
Nurse, I understand very clearly, but please tell me if there is any other way to manage my diabetes, because I am scared of these insulin injections. I don't want to take this. So is there any possibility?
I am sorry to say that there is no any possibility because you already have tried everything you could, and this is the last option to control your insulin, to control your sugar levels. The last option is insulin injections.
Right,
Okay?
nurse, understood. That's very clear. Okay, then if there is no other possible option, then yeah, you can go ahead. You have my permission. Explain me the procedure of taking the injections.
Thank you, Mr. Lincoln. I'm very glad to explain you about the insulin injection. So I will explain you about the sites. The common sites where you take the injection are your upper arms and your thighs and 2 centimeter radius of your belly button. Okay, so you need to draw the insulin into the syringe. You will there are insulin syringes available, so consider this pen as an insulin syringe. So you need to draw the required amount of insulin in this syringe and make sure that there are no air bubbles in it. Once you take the required amount, you pinch a little amount of your skin with the non-dominant hand, and with the dominant hand you inject this needle into your under your skin and inject the medicine into your body. It is very simple procedure, but initially you will feel you will be anxious and you'll be worried about it, but I assure you that there is nothing to worry about it. Insulin syringe has a small needle. You will not even feel a pain as an ant bite. Are you understanding me?
Yes, nurse, that's fine. And what about the injection? Should I change the place, rotate the place of the injection site, or should I take the injection in the same place every day?
No, Mr. Lincoln, you need to take it on different sites every day. For example, if you take on your right arm in the morning, you take it on the left arm in the evening, and next day you take it on the thigh or around your belly. So you will not feel pain, and there will be no bruise on the injected site as well. Am I
Yeah,
clear,
nurse,
Mr.
that's
Lincoln?
very fine. And nurse, I want to ask you one particular thing. How is that possible? Because I'm not a nurse and I'm not a professional, medical professional. So if something goes wrong and any problem persists, then what am I going to do? Will there be any side effects for these insulin injections?
That is a good question, Mr. Lincoln, but I assure you that there will be no such side effects with the insulin injection. Myself, being a diabetic patient for 10 years, I have been on insulin injections for 10 years, and I have never experienced any of these kind of problems. So please rest assured, there will be no such events. If in case, in rare situations it happens, if it happens to you, please consult your general practitioner immediately.
Okay, nurse, that's fine. And what about the used syringes? Can I reuse them, or should I dispose them off immediately?
I will provide you a container, Mr. Lincoln. After using the syringe, you need to dispose these syringes into the container. So once the container is full, I will take it for the proper disposal. Am I clear to you?
Yes, nurse, of course, you're absolutely clear.
Yeah, if you don't dispose them into this container, the discarded syringes may harm you and your family members along with pets also. So please make sure that after using this syringe, please make sure that you dispose them into this container. Okay?
Yes, nurse, that's fine. And okay, is there anything else that I should know, nurse?
Okay, Mr. Lincoln, the last thing I would like to tell you about is your diet and medication. You need to be compliant with the insulin administration. Do not skip or neglect your doses. Okay, so if you are compliant and adherent to the doctor's advice, you will surely recover. And if you are not compliant, your condition will aggravate, and you may land up with the complications of diabetes, such as renal failure or some other heart problems. Okay.
Right, nurse.
Okay, so in order to avoid those complications, please take medication as prescribed.
Thank you, nurse. Thank you very much. That's so nice of you. You have given a lot of information. I appreciate your kindness. Thank you once again.
Okay, Mr. Lincoln.